Are period cramps as painful as a heart attack? Most people experience mild pain and discomfort during their period, but for some, the pain and cramping are so severe that it impacts their ability to function normally. Limited research has even suggested period pain can be as painful as a heart attack. Menstruation or periods are the monthly vaginal bleeding that occurs as a person's body sheds the lining of the uterus. Cells in the lining of the uterus release chemicals called prostaglandins that cause the blood vessels and muscles of the uterus to contract and shed its lining. Prostaglandins are also responsible for the cramping pain that comes before or during a period, with pain intensity proportionate to the amount of prostaglandins released. This video explores whether period cramps could be as painful as heart attacks and what conditions cause them. Can period cramps be as painful as a heart attack? The medical term for period pain or the pain associated with menstruation is dysmenorrhea. It often begins a few hours before menstruation and persists for 2 to 3 days, with the pain strongest during the first 24 to 36 hours. The pain a person may feel can vary from dull and constant to intense spasms. Its intensity can also vary with each period and from person to person. Dysmenorrhea affects 45 to 95% of people who menstruate, and half describe the pain as moderate or severe. What does the research say? There are limited studies that describe or qualify dysmenorrhea pain. However, numerous studies show how it impacts a woman's quality of life. About 3 to 33% of menstruating females report very severe pain that renders them incapacitated for 1 to 3 days, causing them to miss school or work. More than 1/4 of females take work absences or reduce their working hours for at least 1 day per 6 months for period pain. It can also have a negative effect on multiple aspects of a person's life, including their friendships, family relationships, school or work performance, and social and recreational activities. What conditions are painful periods related to? There are two types of dysmenorrhea. Primary dysmenorrhea is the presence of painful menstruation not caused by pelvic disorders. Secondary dysmenorrhea involves menstrual pain due to an underlying medical condition or structural abnormality within or outside the uterus. There are the most common conditions that cause painful periods. Endometriosis. Endometriosis involves the growth of tissues that resemble the lining of the uterus or endometrium to grow outside the uterus. Its most common symptoms are pelvic pain and infertility. It can cause severe, life-impacting pain during periods, bowel movements, urination, sexual intercourse. Fibroids. Uterine fibroids are a common type of benign tumor. They may occur in or around the womb, and their most common symptoms include abnormal uterine bleeding, pelvic pain, bowel and bladder problems, back pain. Adenomyosis. Adenomyosis occurs when the inner lining of the uterus breaks through and grows into the muscular wall of the uterus. Dysmenorrhea and heavy menstrual bleeding are common symptoms. Endometrial polyps. Endometrial polyps or uterine polyps refer to overgrowths of a person's endometrial glands and tissues within their uterus. It is the contributing factor to 50% of abnormal uterine bleeding cases and 35% of infertility. Pelvic inflammatory disease. Pelvic inflammatory disease is the inflammation of the upper genital tract. In 85% of cases, pelvic inflammatory disease is secondary to sexually transmitted diseases like gonorrhea and chlamydia. Symptoms include lower abdominal or pelvic pain, abnormal vaginal bleeding, vaginal discharge, painful intercourse or dyspareunia. Use of contraceptive devices. Using intrauterine devices for contraception may also cause period pain, especially during the first few months of insertion. Tips for managing pain. Several things that may ease painful cramps include doing aerobic exercises, breathing exercises, meditation or yoga, getting plenty of rest and enough sleep, eating healthy foods and limiting foods high in sugar, salt and fat, limiting alcohol and caffeine, including vitamins and supplements in the diet, taking a warm bath or shower, getting a light massage around the lower abdomen. When to speak with a doctor. It is essential to talk with a healthcare professional or an obstetrician gynecologist if a person experiences very painful periods during their menstrual cycle. They may recommend a pelvic exam to find out the cause of the pain and provide medications to relieve it. Painful periods or dysmenorrhea is a common menstrual condition. The type and intensity of pain can vary from person to person and even in one's menstrual cycle. Most period pain is mild, while other people's pain may be severe enough to interfere with everyday activities. It can also be caused by conditions such as endometriosis, fibroids, adenomyosis, and pelvic inflammatory disease. Treatment for dysmenorrhea includes pain relievers, oral contraceptives, lifestyle changes, and home remedies. Individuals with period pain interfering with their daily life should seek medical attention. A doctor can assess the condition and recommend treatments to help reduce the pain.